Hi, I'm Dr. Aviva Preminger and I'm a board-certified plastic surgeon in New York City. I graduated from Harvard, Cornell, and Columbia, and I'm here to talk to you today about blepharoplasty. What is a blepharoplasty? It's a big word. It actually just means an eye lift, an eyelid lift. And it can pertain to the upper eyelid, it can pertain to the lower eyelid, and often it can be combined with a brow lift procedure if necessary. Patients ask, why would you have this procedure? Well, people come in and they tell me that they have tired appearing eyes, that their upper eyelids look heavy all the time. And this can actually even impact their peripheral vision in some cases when it gets so bad. And so there are different components to it. One of the things that happen as we age is that the brows start to kind of migrate or move downwards. The upper eyelid skin gets looser and stretches out. And then you can actually have herniation or protrusion or kind of pooching out of the fat of the upper and the lower eyelids. And often both the upper and the lower eyelids are involved. The procedure is actually a really safe procedure to do, and for the upper eyelid it can even just be done under local anesthesia. The scar is very well hidden in the upper eyelid. It's right within the crease of the upper eyelid, and for the lower eyelid we can even hide the incision within the eye. I often like to combine the procedure, particularly in the lower eyelid, with some laser resurfacing of this area to give some great rejuvenation. Patients are really happy with the results, and one of the things that I really like about the procedure is that no one knows what they've had done. So when they go back to work, people say to them, did you go on vacation? You look like you got some really good rest. And so patients feel good about themselves, and they feel rejuvenated, they feel like they don't look tired anymore, and they enjoy getting back to work looking refreshed. So I'm going to take you through one of the cases that I've done. This is a case of an upper blepharoplasty or an upper eyelid lift, and show you how it's done. Thank you. This is a patient who came to me complaining of a very tired appearance of her eyes. And when you look at her, you can actually see that she has all this extra skin hanging over on her upper eyelids, and she has some extra skin of the lower eyelids with protruding of fat of the lower eyelids, which actually gives her eyes that very puffy appearance. As you can see here, the extra skin of the upper eyelids that is supposed to be removed is actually marked for removal with a purple marking pen. And here I am injecting the incisions for pain control and also for what we call hemostasis, which is to minimize bleeding and bruising. I'm also inserting contact lenses here to protect both eyes. And I place the incision for the upper eyelid right within that upper eyelid crease so that it's very well hidden when it heals. And here I am removing that extra skin from the upper eyelid. You can see how thin the upper eyelid skin actually is. And I remove the extra tissue of the upper eyelid in 3 parts. So the first part that you're watching is actually removal of the extra skin. The next thing we're going to do is remove a little strip of muscle called the orbicularis muscle from the upper eyelid so that we can actually access the fat that's bulging underneath it. There's no loss of function due to that. It's merely to expose the fat that's underneath. And this is some of that protruding fat that contributes to the tired appearance of the upper eyelids. We actually have 2 compartments of this kind of fat in the upper eyelid and 3 of these compartments in the lower eyelid. And they tend to bulge as we get older, and they give a tired, puffy appearance to the eyelids. And that's the completion of most of the procedure. Here I am closing the incisions very carefully with a very fine suture so that it heals up and the scar is barely visible. As you can see, this is a relatively quick procedure and takes less than an hour to complete for both eyes. The sutures are generally removed in 3 to 5 days after surgery. This is laser resurfacing of some of that extra skin of the lower eyelids. And it actually causes a lot of contraction of the skin, which gets rid of that crepey, puffy appearance of the lower eyelids. And at the end here, I'm applying Aquaphor to help soothe the skin. It's really important that after a laser procedure, the skin is kept moist. This is the patient's before and after result, and as you can see, it's actually fairly dramatic, but it looks very natural. and basically gets rid of that tired, puffy appearance of her eyes. And she was extremely satisfied with the result.